question. I would say,
I believe it was 50.
30?
40.
I would say 30 years old.
I think probably age 40.
I've never had a screening for cervical cancer. I probably don't know when. I assume it would be around 45 to 50. 25?
I would say 60.
When they become sexually active, or 21.
In their teens.
Probably when they become first sexually active, I would say.
Ask their family doctor?
Through their family doctor.
Couldn't tell you.
With their family doctor?
Through the Ontario breast screening program.
Oh, girl, I don't know. Screening for colon cancer?
Early detection of colon cancer.
I have no idea.
It's to scan for colorectal cancer.
I wouldn't know that.
Screening for colon cancer.
Oh, is that to test for colorectal cancer, or, yeah, colorectal cancer, I believe.
No idea.
Exercise and eat healthy and lots of antioxidants.
Eat nutritious foods. Cut down on your alcohol intake. Quit smoking. Sorry, that was 3.
If you eat healthy, exercise, and regular checkups. Sorry, that was 3.
Eating Honey Nut Cheerios? I'm pretty sure that is what. Oh. Wear sunscreen.
Well, there's 3 ways. Eat right, exercise, and don't smoke. Those are my rules.
You should begin screening for colorectal cancer at the age of 50. And the reason you do that is because that's when we find that colorectal cancer starts to become more prevalent amongst the population, and it makes sense for all of the population to start screening at 50. Women need to start screening for cervical cancer at the age of 21 if they have been sexually active in the past. They do not need to start screening for cervical cancer, which we know is the pap smear, is the test for screening for cervical cancer, until they become sexually active in age 21. Women between the ages of 50 and 74 should be screened for breast cancer starting at age 50 by calling the Ontario Breast Screening Program 1-800 number. And then after they've made that first call on their 50th birthday, they will be notified after that by the Ontario Breast Screening Program as to when their next screening is due. We in the medical profession affectionately call this the FOBT, or the fecal occult blood test. It is used for screening for colon cancer or colorectal cancer. And again, you start that at age 50. Both men and women need to start doing that at age 50, and then they do it every 2 years. And we can pick up, not with the naked eye, but with a special test on that kit that you do, whether or not there's any little bits of blood that might mean that something's starting to grow in your colon. one way you can reduce your risk of getting cancer is to get screened. And hopefully we'll have more and more screening tests as time goes on so that we know that we can prevent cancer.